Hi, I'm Dr. Dean Harrison with Chiropractic Biophysics Seminars and Technique in the Ideal Spine Health Center. I'm here to show you the second setup in our series on the new Denneroll 3D traction table. This setup is to correct for a patient that has, number one, a normal pelvic tilt or sacral base angle. Number two, they have a large posterior thoracic translation with hyperkyphosis. And then they also have a forward head translation as the primary problem. So what we want to do is we want to set them up and stop the pelvis from flexing forward while we translate the rib cage forward, flattening out the thoracic curve and pulling the head back. So we've got our volunteer patient, Dan, who is our personal trainer here at the Ideal Spine Health Center. He's going to volunteer. We've got the table set up. I've got the pelvic strap on letter K on both sides. I've got the shoulder strap on letter G on both sides, and then I've got my translation block for the rib cage, and I've got a support block for the head. So come on back, Dan. Dan lays back. What I'm going to do is I'm going to snug his ASISs down to the table, and you'll watch he flattens out nicely, so we get him nice and snug there. And then what I do is I put the shoulder strap on, which is going to flatten out the shoulders. I want to snug down both sides and lock Dan in. And then he's just going to translate his head backwards. So the part for the head is really an active translation backwards. You can see we've got some slight extension, but that'll come out the more we load the shoulders down. So this is setup number two. It shifts the rib cage forward, it flattens out the thoracic curve, it pulls the head backwards, and then it stops the pelvis from flexing forward using the Denneroll traction straps. So till next time,